computer. Got some people coming in. Admit, Danielle McGuire. All right. Awesome, awesome. And let me just get one quick thing here. You guys give me a quick, oh, hey, Phyllis, how you doing? Give me a quick thumbs up or something. Let me know you could hear me okay. Hello, hello. Let me just make sure I have the video working all right. You guys hear me all right? All right, good, good. Facebook is saying that it's just having some problems, and looks like I'm frozen here. So, all right. Looks like it's coming on. Cool. All right. Well, we'll leave it at that. If you want to, awesome. Thank you, everyone. Let's see. There's the Zoom link. I'll just put it in. If anyone wants to join from Zoom, I'm going to put it in the comments. Good. Yeah, that was delayed. That was weird. That was weird why that happened. So, all right, cool. Let me just have some notes here. Welcome, everyone. Let's see. Got a handful of people joining, and got some important things to talk about today. If you lose me for any reason, just post in the comments, because it's weird. The video is actually cutting out, so I just want to be sure that we're live here. See more people coming in. Cool. All right. Hey, fellas, can you hear me all right? All right. Good. For those on Facebook, just give me one more quick thumbs up or something so that I could see that you could hear me. Whoops. You know, you'd think I'd have this figured out. All right, pin my video. That's what I want to do. Perfect. All right. So, all right, cool. I think we're rolling here. Everything looks good. I got us going. Good. Thank you, everyone, for the confirmation here. So let's dive in, since we'll be recording this and people could always come back and view it. Just as we go through this, if you have questions, you can put them in the comment section in Facebook, preferentially, because it gets saved that way, and therefore I could always go back later and add comments to it. So that'd be really great. And second, just thank you, everyone, for taking the time out of your day and joining me here. This is, I counted, we're on number 13 here. So we've been doing this for almost three months. A few weren't weekly. There were a few that were more in 1 week. So I'm really glad and thankful, grateful for everyone who's joining us and everyone who's watching these. So that's really, really cool. All right. So there's a bunch of things that I want to talk about here. A handful of really 2 or 3 really important things. First, I got some questions about the vaccine information that came out the other day. And let me just say this, that, any positive information is really good, okay? We want to see, we want to hear positive information. We want to hear good things from research companies, from these drug companies. We want good data, but there's some things that are really important to understand. First of all, the data that we got the other day from Moderna, actually, my guy I went to residency with is the president of Moderna, and so one day I'll hopefully be able to talk to him. But the information, you have to be just like everything, you have to just be really careful about the information, that how you interpret all of this information, right? It's great that it's positive news. It's kind of like saying, if you're taking a 1,000-mile journey and you said, hey, I took my first step today. Like, that's great news. It's better to take the first step and not take the first step, or to walk backwards, right? But the information that we got yesterday was the equivalent of one step on a 1,000-mile journey. So anytime, there was the trial, it was data from 8 patients, and it's still very, very early as far as knowing whether this is an effective vaccine or will be an effective vaccine, or if it will even produce antibodies that confer immunity. There's so much that we're going to need to learn from this, but it's good news, okay? And, unfortunately, you have other forces at play here that push and pull that information. And so all of you here get this opportunity to kind of understand a little more insight, if you don't already, you may, about what this means, about when you get data about a vaccine or a research company, pharmaceutical company releases information like this. So think about it in your mind of a single step on a 1,000-mile journey, and hopefully every day we take another step forward. That's what we really need. So hopefully we get more of that. Okay, whether or not we actually will be administered a vaccine in 2020, highly unlikely. I hope I'm wrong. I hope there is an effective vaccine that we could all be administered. And like I've spoken many times before, every episode that this comes up, it's not just the idea of getting a vaccine. It's the fact that 7 billion people in the world, or close to it, want a vaccine. So it's how do we distribute it? How do you manufacture it at the scalability and quantities that is necessary for it to be distributed the right way. So having a vaccine is like getting to the toll booth, right? If you're taking a trip and you're on the turnpike, let's say, because I know we have a lot of Jersey people here, and you still, you're going to someplace, you got to get off at an exit, but you still have another, 30-minute drive after you get off the exit. That's like what this is with the vaccine. Even though you have the vaccine, there's still much more that needs to get done after that. Okay, so I actually think that a vaccine is not the savior here, in the sense that it is extremely unlikely that we will have an effective vaccine that is, 80, 90, 100% effective before we reach our own herd immunity with, 60, 70% of people being infected here. I hope I'm wrong. It would be a much more pleasant world if we do get that. And I hope we can look back at this and I'm wrong. But it's a very difficult journey to be able to do that. Okay, so that's the vaccine. If you have any questions about the vaccine, just put them in the Facebook comments. That would probably be best. But if you're on Zoom, you can add them to Zoom comments as well. You could add them to there's a chat bar in the Zoom. Okay, so go ahead, add any questions you want to Facebook or Zoom. And yeah, I don't even know if Facebook's still happening.
You paused on there.
On Facebook, huh?
Yeah.
Yeah, it's terrible. There's nothing I can do. It's not like I'm doing anything here. Let's see here. Your video, oh, it says your live video has ended. Okay, let me try something else real quick. I'm gonna go live on Facebook again on the new feed here. This should be 2 seconds, guys. I got this figured out. All right. Take 2. Go live. All right. You know, the Zoom integration doesn't work so hot. Okay, should be updating in just a second here. We are live now. All right. We are good to go again. Sweet. Okay. So I'm just going to refresh my screen here. And I'm just going to tell people, go to new feed. Okay. So if you have any questions, just post about the vaccine, post them in the Facebook feed or the Zoom feed. So we should be good to go there. Okay. Next thing that I wanted to touch on here was, right, clearly people are fatigued. Many people, not everyone. We have people who are fatigued, people who just want to get back to work, people who want to open up things. All of this was pretty, it's understandable for sure. And it's probably, it's expected in many sense that it's hard. Think about this. Think about how many people want to go on a diet and can't sustain that, right? People who say, I'm just going to eat a little less food today, or I'm going to eat a specific meal each day, or cut something out. And we all struggle with that, right? I mean, every single one of us probably. Now think about what we've been asking people to do, to stay inside for months, couple months, and or to behave in certain ways. It's just natural, right? The behavioral psychology is going to tell us that people are going to get tired and fatigued here. So this is what we're seeing here, and I'll try and my interpretation of where we're at right now, especially in Michigan, a state that's at the center of this, is what happened is we've had the states and really the country, right? This starts at the federal level, has never had objective criteria that has been really clearly delineated, that has been consistently stuck by, that that people could look at and say, okay, this is why we need to do this right now. And if we meet this certain criteria, we could then go do something else. And if it changes, that's fine as well, right? Criteria could change based on the moment. So one of the issues that we've had is there's been no consistent message, right? This is about messaging, communication, and trust. Another thing that we've been talking about for many, many weeks on these episodes here is because we have that lack of unifying message, it's caused this chaos and confusion. And people don't know what they should or shouldn't do. And what it's going to lead to is what we're about to see now, right? We're about to see half the people in certain states don't care or don't believe things or just need to get back out into work. And they're going to do this, okay? And there was a way to approach this that would be a little different than where we're in, but we're in here now. And so we have to deal with this. We can't rewrite the past. And what we will see, right? It's almost inevitable. We will see an uptick in cases. Now, here's kind of some of the caveats about that. It's possible we don't see an uptick in cases right now. That is very possible. And in fact, if we don't, it's actually more concerning, believe it or not. Or at least that's my take on it. Because we still don't know what the pattern of COVID-19 is going to be. When you study all the influenza pandemics, it happens with different frequencies throughout the pandemic, right? You've heard this about waves and phases and things like that, right? The recurrences. And the worst of the influenza pandemics in 1918 started off with something very similar to what we just went through. And then it went away. It almost disappeared throughout the summer. And then in the fall and winter, it came roaring back, worse, two times worse than what was experienced in that spring. And so if we see a significant drop off in cases, my greatest concern is that we are going to have an influenza-like experience of the seasonality that comes with it, and it's going to come back with a vengeance. Okay, in 3 to 4 months, it will come back with a vengeance. Whatever you do and believe, just know that there is no escape from what we have to deal with here. All right. As far as it's nothing will just disappear. This is not going to just because we're going back out or orders are being lifted or cases start dropping. If they start, that is all that's expected as a possibility, right? We cannot predict what this will look like as far as peaks and valleys. And that's the only certainty we have, is that it will be here. We just don't know exactly how. And I went over to kind of the 3 scenarios that Michael Osterholm has painted, right? You could have the dip that we just had, a period of quietness, and then it's going to come back with vengeance, what we just described, and it's going to hit 50%, boom, right away within that year. And then it will start trickling down. Or we will have kind of just peaks and valleys like we just had, but more frequently. Or we'll have a slow burn where maybe it's like what we're at now, where we don't have to shelter in place, but infections are happening. We still have, here in Michigan, right? There every day there's infections, and in the country, every day in the world, every day there's infections, okay? And what you're seeing still, a couple things, right? People always say, well, look at South Korea, well, look at Finland, like whose model should we follow? And in the end, you could look at any country and it will change from day to day, all right? There are ways that we should be doing this, and unfortunately, we don't see the alternatives. We're not given the alternatives here in America right now because we don't have the infrastructure, and I've gone into great detail about this in other episodes. But right now, if you look at South Korea, Germany, and China, you're starting to see cases increase again, and it's expected, right? That's not surprising. That's not unusual here. That's going to happen. Now, it's just how it's going to be dealt with. That's the important question. Cases may rise, but it may not overwhelm a hospital system, and so things could keep going on. 70% of people will develop antibodies to COVID-19 one way or the other before this thing is done, okay? That is one of the facts in this case. Now, Sure. On the rare case, could you get a mutation in the virus? And yes, okay. But the odds of that are slim. So let's stick with what the greatest probabilities here. 70% of us will have antibodies, whether it's through natural immunity or through vaccine. That is the end of this, and that's it. So we could wear all of our masks. We could, and the reason why we wear it, by the way, so just philosophically, and so you understand kind of, we wear our masks, we socially distance, we do all, what we just went through was so that we limited the number of preventable, of deaths that were excessive or as far as preventable, okay? Now, what we do is the whole goal is to try and delay for a vaccine, right? That is the hope. In that's why we wear masks every day. That's why we're going to physically distance, because if we do that long enough, maybe there'll be a vaccine available. And that could be, a year to 2 years. So that's one option here. And that's why when I always say this is just the beginning, it's really just the beginning of dealing with this. We will be dealing and living with COVID for a year, 2 years, probably somewhere within 2 years. I think we're in the third inning right now. And what I mean by that is we just came over a peak. Cases are declining. And it's like, a third of the game is over in a sense. However, the third and fourth and fifth innings, they could be really long innings. It's just the way I see this as like what we just all experienced was the introduction of a pandemic, right? The first part of it. And then the sheltering in place, the high mortality, and now we're on the other end of that curve for kind of this big push. So this is the first part of it, first third, and we have a long game ahead of us. As far as other things to, maybe you guys will have some questions that I could touch on it. The three things that I wanted to make sure that I touched on was the vaccine information, what's happening with our behaviors now of wanting to get back out and the implications of that, and the duration of this and what other countries are dealing with right now. And if we want to know, what this will look like, it's just look around. There's no escape. Even you take countries who have the perfect infrastructure or as close, who have excellent infrastructures. You take a place like Germany and South Korea, they're going to get hot. They're going to get, these hot spots, these little fires that pop up and burn. And that's just the reality of things. So, if you guys have any comments, feel free, post some comments, because that's really mainly what I got here. So let's see, I have a comment here on Zoom. Can we talk about the children's illness that is out there? And if you see this escalating. So yeah, what we spoke about last week, pediatric multi-system inflammatory disorder or syndrome. We still learning, don't know that much more about it. There's been some cases, some deaths, and but it doesn't seem, it's everywhere. It's pretty universal, and it doesn't seem to be, growing at any measurable rate right now. But that could all change. So I would take that day by day, week to week, for sure, to be able to learn more about that. Anything else? I may have frozen on Facebook here. I don't know if I'm going to do this Zoom Facebook thing next week. I guess someone's got to call Zuckerberg up, tell him this thing. He's got to upgrade his Facebook. All right. So I got a question. Ken Schwartz, say another country or we develop a vaccine. Is there an international law that requires countries to share the vaccine recipe with one another? I'm curious if an adversary country would give us the cure if they found one and vice versa. That's exactly right. I mean, Ken Schwartz, you nail one of the the philosophical, moral, and ethical areas of vaccine development. You're exactly right. What if America develops it? Does that mean that Americans get it first, right? What if there's a country, take a country like what Brazil's going through right now. Do we, if we had it under control, which we don't, would we give it to Brazil first? So these are the discussions that we need to be having right now, right? There needs to be an international and national debate on vaccine administration, right? We need a plan for once we do have, if and when we do have an effective vaccine, how is it going to be manufactured and distributed? Who gets it first? Yada, yada, all that stuff, right? Do you think that this is really happening? I doubt this conversation is happening, all right? That's the conversation we need to be having right now. And it's one of the reasons why we shouldn't be, adversarial with a place like China right now, or any country, because it's right. We've always said we're in this all together. And, let's say you take a country like Russia or Germany or China that develops this vaccine first, what's their incentive? What's their incentive to share if all we're doing is creating, xenophobic, false, spreading misinformation about another country and their influence on COVID-19. So, it's not helpful. It's not helpful to do that stuff. And, COVID-19 did not come from a bioweapons lab. Sure, mistakes were certainly made in detection. In retrospect, it's absolutely. But, there's no conspiracy here around that, okay? So, great question there. Another question. Okay, Christy Connie on Facebook, remind me how many times you can rewear a K95 minus sneezing, coughing in it. I don't know the answer to that. I think I would just base it on common sense in that, like, if it starts to get real raggedy, and you see maybe it peeling, you see a lot of the fuzziness start going away or coming off, I would say that's probably long enough. But remember, the masks are really most important for when we're in groups of people. If we're not in groups of people, I wouldn't necessarily wear a mask. If you're just going for a walk outside, I wouldn't wear a mask for that. If you want to be vigilant about it, then absolutely wear the mask for sure. But I would like if you had a little dirt on the mask, I wouldn't worry about it. If it got wet once and then it dried, I wouldn't worry about it. But if it looks raggedy, I would use that as to just give it up. Okay. All right. So some more questions. Let's see. I'll come just to Zoom here real quick, and I've read that in some states more tests are available than people who are getting tested. Why is that the case? Should everyone be getting tested now, or should it still just be people who have had exposure to COVID or are exhibiting symptoms? So this is a great, great question. The reason why this is happening is because there is no plan on how to administer tests, okay? It's not just saying we need to test is not enough, right? You need to say, okay, we need to get tests. We need to get tests that are accurate. We need to have a system to administer those tests. We need a system to get the readings from those tests. We need a system to convey the readings to that test. We need a system to then implement what happens if it's positive or negative in those tests. We need a system to test people, right? I mean, honestly, this is not rocket science. It's some basic public health and infrastructure. It's just that there's no one in charge, you know? It's like the inmates here are running things. And so what happens is you're going to get asymmetries. You're going to get states who have more tests than people going to get tested. You're going to have places that need tests who aren't going to have them. And that is because we have no central command, all right? It's almost like, right, like fighting a war, and you know, our country's fighting a war, and you're just leaving it up to the states to just make these determinations of what to do. And you know that's going to run into issues. So we do not need to be testing everyone diagnostically, all right, at all times. There needs to be what I call smart testing, right? You want to test, ideally, people who are in right, testing is most effective when you're in high prevalent areas. So any of the cities, New York, Detroit, New Orleans, like everyone there should have serological testing. And you want serological testing there because if you identify people who are protected, who are immune, you could get those people out and about. But if you're in some rural town in Idaho where there's been, you know, 1 or 2 confirmed cases, you don't need to test an entire town for serology there, right? You don't need to do that. You need smart testing. And, you know, diagnostic testing is good if, let's say, you need to organize a group of people, or we're thinking about school, or we're thinking about, you know, things that are going to have more groups of people or meetings or things like that. That's where diagnostic testing would become very useful, right? If you're just home, there's no need to get a diagnostic test. If you're asymptomatic or you have a little cold, like there's not, and you're still socially distancing and doing things that you're supposed to be doing, there's no rush to get a diagnostic test. If you could get one, right? Like that's totally fine. But we don't need a system finding you to give that diagnostic test. Now, in areas of high prevalence, you're going to get better results. In areas of low prevalence, and prevalence is the number of you know, total infections in the population. Incidence is the number of new infections that are happening. So you want areas of high incidence or high prevalence or both. Those are the places where tests should be concentrated in. So, okay. So hopefully that answers that question. This is a, you know, you need to align the infrastructure with the need, okay? It's almost like wealth disparities in the United States, right? Sometimes like the greatest wealth goes to areas that don't need it. I mean, I don't know if that's the case or not. You know, I'm just kind of saying, right? You need to align where tests go, with your infrastructure in order to make it most effective here. Okay, let's jump to Facebook here. Okay, all right, no new wait, there's 11 questions here. Let's see. I can only see, I can't see the face. I'm gonna try something. This could be dangerous, but I'm gonna try this here. All right. Question on Facebook here. I could have just screwed something up, but I'm gonna keep going. Okay, let's see here. Yes, Kawasaki. So the question is about Kawasaki affecting people in Europe. Yes, definitely in Europe. In fact, they were the first to identify it. England, Italy, France, and it's probably in more places. I haven't been keeping up with it as much as I should have right now, just because there's not that many. There's just not that much information coming out. So yes. Okay, next question. I know you've touched on this before, but any updated thoughts on surgical procedures being started back up at the end of this month? Yeah, I think you're gonna, you know, if it's something that you need, I think it's fine to do. If you are, you know, if the parties who are going to be doing everything, the procedure, and that everyone's aligned in the proper precautions, to do the procedure, right? So the hospital has the proper cleaning procedures, disinfecting procedures. The nurses all have their masks, and doctors have their masks, and surgeons. You know, I think it's reasonable. If it's something that could wait, let it wait. But if it's something that you feel like it's important to you, then I would say get it done, you know, and just make sure you have masks. That's just that barrier is really important. You know, if you could get an N95 or KN95, those would be, that just makes things so much better. Okay, what else do we have here, guys? You guys are quiet this week. I know you have some more. I know you have more info, more questions. Don't be shy. You could ask it. Everyone's thinking it. If you think it, that means many more people are thinking the same thing.
Adam, there's another question on Zoom.
Oh, all right. Where is it? I only have 3 in chat. Oh, here we go. Yes, from Randy. I have heard about recommendations that people should cut their hair, shave their beards, or not use jewelry if they're going to go back to school or work regularly to be more safe. Any idea about it? So I think so here's, you know, COVID-19 is a respiratory virus. As much as I feel like we spend way too much time worrying about contact contamination and contact infection and protecting against that, right? I mean, how many times did we talk about food delivery and groceries? And the real concern is in the air. This is a respiratory virus. So I think we need to be most mindful of that, right? How do we limit that? And that's with masks and keeping a distance from people. I think the shaving and hair and beards and jewelry, look, if you want to be vigilant about it, then by all means, you know, then it may be another layer of safety, but I personally would not do that. I don't feel like it's a significant enough risk that, well, first of all, I barely have any hair. I wear no jewelry, and I don't have facial hair. So this is an easy decision for me. All right. But if you're someone who maybe has, you know, dreadlocks or a big, you know, poof of hair, you know, maybe you want to do that. I don't know. Maybe you want to put it in a ponytail or something, right? Or just bunch it up or whatever. Maybe you want to do that. So hopefully that answers that. All right, I think we got a couple more here. Okay, Joyce Crum, do we know how long the virus lasts on surfaces? Okay, so that's a piece of information that it's nice to know. It feels good to know that information. But just because something is on the, and I just want to preface this with this, just because you have an agent on a surface doesn't mean it's infective, okay? That's first. So the virus is thought to last, you know, there's studies on this, and these things always change, maybe a few hours, right? So when I say, you know, we spend too much time worrying about the surfaces, it's not that I'm saying we shouldn't worry about it. It's that our worry is a little misplaced, that's all. In that we need to do everything we can to prevent respiratory spread, because that is where this will spread, if, you know, versus direct contact. Because the things that have to happen for direct contact, it's like one thing after the other, and all of these things kind of need to align. For respiratory contact, it's pretty simple. you're talking to someone who's infected, you could be infected right there, right? Because you're breathing in, you don't even have to be breathing in, right? If someone's speaking, these droplets that are aerosolized could easily, harbor, move right into your nose. So that's the important point here. I think that's the important part of this. Okay. Another question here. People are asking the library to offer curbside pickup. Do we know how long the virus stays active on surfaces? Okay, sorry. Yeah, I don't think we should shut down. I think we should definitely encourage book exchanges. And look, if you're like a city and you have some resources and you're in an organization, it kind of makes sense to me that sure, we could probably spend the time and effort to do some sanitizing on objects that are going to be exchanged from person to person. I think that's a good habit to adopt during COVID-19. It's not going to, right? Like that could add a layer of safety. How much safety? It's debatable, but it certainly is a good habit to have. Okay, for any high touch area. And I think like we could extrapolate that, right? Any high touch area should be cleansed frequently. So if you own a restaurant or you're in a store, or you have a store, right? Door handles, things like this, those things should always be cleaned, right? Because the risks go up the more and more people. When you're dealing with hundreds of people touching something, you have to multiply each one of those risks together. When we get a food delivery, right, that's different to me. That's like saying, one person, two people touch a box of pizza and then deliver it to you, and it has to get, there's just very, the concentration here is different. So hopefully that is useful. Okay, Megan. Gosh, I'm not even going to get into the last name thing. So with easing up a bit on restrictions, can we expand our circle somewhat if we were following all the rules? I just want to hug my mom. Okay, in the ideal world, right, you would be able to hug your mom by saying, okay, I just got tested today and I am negative. And mom, you just got tested today and you're negative, right? Or I know I have I have immunity, right? All of those things would make these decisions so much easier. Okay, now, if you wash your hands and you're wearing a mask, I say go hug your mom. I think that's reasonable. I think that's a reasonable thing to do. If you've both been, right, pretty vigilant in maintaining your physical distancing, that you're not high risk, right? If you take low risk people and put them together, you create a low risk environment. If you have low risk and high risk, that's high risk, okay? So think about it that way. I think it's reasonable to maintain the physical distancing, the mask wearing, and still, get together, but not, I don't say get together like have groups of people over for dinner. The more time we're together inside as groups, the higher risk of infection, okay? So ideally, if you want to meet with people, try and do it outside, because when we speak, we have to remember this is respiratory virus. And when we're outside, the currents, the airwaves, right, it naturally is going to disperse our droplets, all right? And when you get infections from respiratory viruses, it has to do with the kind of the bolus, right, the load of the infection. And so it's always better to be outside if possible, and think of it like that. Hopefully that makes some sense for you here. Okay, what does it look like this summer for community-based activities? Tennis, single tennis. Yeah, so sure, we should play tennis, but here, look, let me just back up again, because all of these questions are really good, but there's one unifying thread in all of these. We are operating with a half a deck here. And what I mean by that is we have no, we do not have a robust infrastructure or leadership to implement what ways that we could do all of these things to make this easier for us, okay? And so therefore we have to make these decisions with, in situations that are less than ideal, right? Ideally, if you're in a place that had a high infectivity rate or a high prevalence like Michigan or New York or New Jersey, everyone would be access to testing so that you could test yourself and or right, you could have access to testing and then get together and go play some sports together, and that would just enlighten you and provide the information to know that the risks are much lower. And regardless if you don't have those tests, yes, I do think you could play tennis. It's totally reasonable. Abide by the same rules, right? Socially, physically distance, don't touch your face, don't pick your nose, things like that. You keep doing those things. Now, if you're a very high-risk person, 70s, 80s, comorbidities, you just want to be a little extra cautious when you do those things, okay? Just make sure you're more cautious. But we need to live with COVID. This is what we keep saying. We need to find ways to live with COVID. All right. So it says there's 18 comments here on Facebook. I only see the last one from Michelle Brown Schwartz. There's one from Harriet Siegel Brown, Megan, Julian. Oh God, I practiced that. Joyce Crum. And I don't want to mess with this comment bar here. Let's see. Maybe I'll just mess a little. Oh, let me see here. Yeah, I'm not going to mess with this. Okay, any other questions? I see Barry Contricker on Zoom here. He's, you know, this guy has over 200 Peloton rides. I don't know. He must do Peloton in his sleep. It's crazy. Okay, cleaning. So here's a question that has come up. My mom asks me this all the time. She says, "Can we have someone who cleans houses come back?" And this is what I would suggest. If you don't need it, don't do it. Okay. But that's only in the most extreme cases, in the sense that, like, if you're fine, if you've learned that you're fine, just don't do it. The other options I would give is, sure, you know, because, right, someone who is cleaning homes for a living, for work, is going from home to home. And just the nature of that increases risks a little. If you have a KN95 mask, give this to the person who is cleaning your home. In fact, anyone who enters your home should have a KN95 mask on, okay? That, unless, now remember, this is in our current world. If we had testing that was universal and easily accessible, that may be a little different, right? You may be able to do a point of care test. Someone wants to come in your home, you give a point of care test, they're negative, they come in, but you still physically distance. You absolutely have to maintain physical distancing from anyone who has not been living in your home, or you have not been physically distancing yourself for a while, okay? Or if they've been truly quarantined for 2 weeks. So hopefully those are some decent guidelines for that, to think about that. So if you can't give them an N95 mask or KN95 mask, if you don't have one and you can't give it to someone who's coming into your house to clean, then perhaps you leave your house for that 2 hours or 3 hours, right? Go do something, go for a walk, go get in the car, go for a drive, go do something. That would be great as well, especially if you're in the higher risk groups, right? But if you're in the younger or lower risk groups, I would just say, maintain your distance and put a mask on them. And that is pretty vigilant. That is pretty good to do things, okay? Okay, Kelly Maureen, without the central plan and infrastructure that you mentioned, do you have any suggestions for ways to keep schools safe when they reopen? What would be your top safety measures in terms of scheduling, distancing, small classes, kids stay, and teachers move? No. So look, you know, if we open up schools, this is, you know, the best, this, you know, I don't, you know, there's a lot to this. This is a complex question. You need an infrastructure to open up, right? It's not like, right, this isn't binary. This isn't a binary decision to say open or don't open. It's you open when you have the proper infrastructure in place. That would be the way to do it, right? So, you know, I can't say do this, don't do this, do this, don't do this, or yes, this is, you know, what you should or shouldn't do. It needs to be put together in a way that is smart and thoughtful. Whenever you put 200, 300, 1,000 people together, you have real risks there. So how are you going to do it? Obviously, you want to implement physical distancing. You want to implement a system of reporting, right? I mean, it's the same things that we've been talking about for months now. No, it's, you know, there's no kind of, you know, our guidelines are so weak in these areas. And there's so many people having to make these decisions, you know, a whole school district, you know, you're going to have 800, you know, you're going to have 50 people needing to sign off on these things. It's complicated. It's hard. So anyway, I hope that is a little helpful. So Heather, how do you feel about sending kids to camp this summer? You know, it's a personal decision. One, you have to trust your camp. Do they believe in COVID-19? Do they believe in the risks? Do they have a system in place that they're going to attempt to physically distance as best as possible? Do they have a system in place with redundancy and contingency plans if people get infected? How are they going to manage that, right? This should all be published. They should have objective criteria. If this happens, we will do this, okay? You need objective criteria. And they could change that criteria, but it should be published so they know. If a counselor is positive for COVID, this will be our response. That is how everyone needs to be operating. And you ask me what school has that? Does a school have this? Does a camp have this? Does a school say what's going to happen if, you know, 10 kids are testing positive? Are they shutting down the school? Are they sending kids home? What are they going to do? Those are the questions that need to be answered. All right, and that's what teachers should be doing and administrators should be doing all summer long, or right now, really, into the summer. They're hard decisions. It is not easy, and that's why you got to have those discussions. And you have to have them now, okay? Because they're going to be much harder to make later on. Brian Rowena, how's it going, man? By the way, anyone ever need a right wing for their soccer team? I'd contact Rowena, man. Kid could still play. All right. What are your thoughts on schools opening? Sorry, I didn't even see that question. Yeah, so those are my thoughts on this. You know, many are going to open. We have to live with COVID, right? We have to actually get out there and get back and get working and get schools going. We have to do all those things, but we need to have the discussions, the infrastructure, the plans in place, the smart testing to do all of these things. And it's not easy, right? I'm here, you know, yapping away of like what we need. And you know, there's people who actually then need to take the idea and implement it. And that is hard. It's very hard, and we learn as we go. So I'll leave it at that. There is no yes or no to that. Is it safe or not safe? It's not about safe or not safe. It's about there's risks with everything, and there's a risk here for sure. And how do we mitigate those risks? All right. Danielle McGuire, have you talked about? By the way, Brian, you could still play soccer. I'm sure you can. Yeah. Okay. Danielle McGuire, have you already talked about the pediatric system inflammatory thing yet? Yeah, the pediatric multi-system inflammatory syndrome. Yeah, your mom asked about it, actually. We don't have that much more information about it yet, so we're going to hold off in talking about that maybe till next week. We'll do this again. Anything else? Oh, here's another question. How far apart from non-systemic friends is far enough not to wear a mask outside? 6 feet, right? So at least 6 feet. We should always be at least 6 feet from people. And, outside is safer than inside. Outside safer than inside. Okay, Megan's giving us some feedback from the front lines here. She works in a school, and right. So the guidelines to reopening are absurd. These kids cannot possibly adhere. Right. And so taking that into consideration, like, you're not going to get kids, not to touch one another. Kids are going to do these things. They're going. So trying to enforce physical distancing in kindergarten or second grade, that I think you do your best at that, right? The things that just kind of come to the top of my head is to think about what happens when a kid's infected, or what happens when a family member of a kid's infected, or what do you tell parents of kids who are going to school, right? What should they be prepared for? Do they want to send their kids? I think there needs to be a stay-at-home option for everyone. I think there has to be at this stage. So, I think that's we're gonna make mistakes. We're gonna learn. We're gonna make mistakes. But the important thing is to engage in conversation, okay, in productive conversation. Okay, yeah, these comments are like disappearing from me. There's probably a whole bunch. How come I can't see this? Let me try this. I may screw this up. I think that's one sec here. All right. Oh, I just fixed this for myself here. Awesome. Okay. Sweet. So, can anyone take hydroxychloroquine to stave off COVID? Danielle already heard my rant on this, and here's the deal here. Here's the deal here. This whole thing with hydroxychloroquine, it's politicized. So I'm just going to leave it at this. There is evidence that, right, just because the lack of evidence lacking is not the lack of evidence in a sense, right? Like, we do things all the time without proven results. And so while I, disagree vehemently with much of how this leadership has taken on this pandemic, like, if someone wants to take hydroxychloroquine in a position like that under doctor's orders or under doctor's advisory and monitoring, that's fine. There is lab testing that shows that hydroxychloroquine inhibited COVID-19 virus. Now, we know that it also has serious side effects and serious consequences. And so, is the president, is this amoral? So just step back. It's like the whole thing that we talked about with the vaccine. Take a step back. Don't politicize it. And just you know, take it for what it is, and it's fine. Okay. Okay. Thank you, Miss Burkhart. All right, Brian Rowena at Parents. They said, "What's up? My mother just told Peyton you were one of my smartest friends." Yeah, I don't know about that, but thank you. So, Mike Russo, they're going to make a movie of your wrestling coaching career one day. I'm sure of that. Okay, let's keep going here. My Aunt Edie Mincer, my community is offering antibody testing. Do you think we should take the test? Yeah, I think taking the, I think if you, this is a great question. I think ideally if you were in a high prevalent area, Florida is a high prevalent area, especially in South Florida, I think you should take the test, yes. But you have to just understand that these tests have high false positive rates, they have false negative rates as well. Ideally, you want to know which test it is and look up the sensitivity and specificity. And if you are positive, you want to know you want a quantitative test, all right? You want to actually be able to measure the antibody. The test that just says yes or no, you have antibodies is qualitative. That's ripe with error, okay? You actually want to measure the antibodies levels. That's a much more specific test, and it's much more useful. If you know you have an antibody, if you know you have protective antibodies, that's a game changer, right? You could get out there, you could help your community, you could help friends, you could do things in a way, you know, that is much safer than not knowing, okay? And you should still take the proper precautions, even if, by the way, you have antibodies. It's just that it's, you know, you could be, it's just a different level. Okay. Let's see here. All right, Brian Rowena, you bet. Have a good one. We've got some new people that recently joined. They may not be actually live right now. Okay, here's another one. When we start living with COVID by reopening, should people be tested regularly, like once a week? In other words, what should a plan look like? I'm tired to to get into that right now, but maybe next week we'll talk more about it. You know, you could probably find some plans published. You know, plans are, you know, there's not one plan fits all. Different communities need to have different plans, but the basics are the same, okay? The fundamentals are the same for sure. Yes, we need to be doing testing where when anytime there's going to be a gathering of any kind that's still limited, if you could test, that would be helpful. Testing is going to be a focal point of living with COVID. It's not the answer, but it's a component of it. All right. So I'm going to, I'm not going to go into too much more on the plan, on like specifics there. I just don't have the stamina right now to do that. All right, what other question? We got a lot of people joining now. I don't know if you're joining, you know, when you join. Oh, I guess if you join live, yeah, I guess you could still, you could ask questions. So feel free. I'll just stay on a few more minutes. Anyone want to ask any more questions? Oh, I see here. You guys have any more questions at all? There's some good stuff for those that just joined at the beginning. We talked about kind of the vaccine data. We talked about kind of the fatigue that's going to set in. We talked about the trajectory, the expectations over the next 3 to 6 months. So Juice just joined. How's it going, man? Got a lot of people coming on Facebook now. So if you have other questions, maybe something happened to my Zoom feed. But feel free to ask questions, or maybe that's just catching up. I'm not sure. Let me know if you, hey, oh, no, this is brand new. Yeah. Excellent, excellent. Let me know if you have any more questions. Otherwise we'll wrap it up here. We got next week too. Let me check the calendar. Next week's a good one. Post Memorial Day, that will be fun. Memorial Day is going to be very interesting. Danielle has 6 minutes left on her Peloton ride. I will keep talking. I could talk about anything. Bring up any topic, by the way. So Memorial Day is going to be really interesting, and it will be an interesting experiment, because there's going to be, it will either, if we attach what I'm about to say to the beginning of how I started out in this session here, we may be on a real decline with cases, but that doesn't mean COVID's going away. If we're on that decline and it really doesn't matter if people get together, that may be possible. That may happen over Memorial Day weekend, right? It's possible that despite people getting together, that we don't see a big rise in cases. It's going to be interesting. We'll see those results in 4 to 6 weeks, right? What happens today, we'll see in about a month or so. So that will be very interesting. Good. We got some good questions going on. Juice. A lot of pressure for our kids to start practicing with teams outside. Thoughts on outside play with social distancing? My kids too. I think you gotta. If I'm the coach, I'd wear a mask. I'd be physically distanced. If you're a kid, you want to do your best to physically distance. Obviously, I think having group practice with sport like wrestling would be a little more challenging to do right now. Rugby, football, those are going to be challenging. But soccer at a distance, I think there's ways to do it. Ideally we had testing to augment things. That would be great. But you have to look at this as, what is the risk to you, your family, society? I think it's important to get back and get the kids out and going and do all of these things. We just need to have a plan. So if you're a coach and you have a team, what's your plan if a kid gets infected? What's your plan if a family member gets infected? Are you going to stop practice? Are you going to cut the season short? Think about those things now, right? And make sure that all of your parents kind of sign off on that. I don't mean a real contract. I mean they're made aware of what the expectations are. It's what we've said months ago. We said this weeks ago in our calls. The businesses that adopt the proper practices, this was 2 months ago, sooner, the better off they're going to be. It's going to be the same thing with schools, camps, teams. The sooner you could have objective data, objective decision making, the better off you're going to be, right? The sooner you could get buy-in from everyone to say, okay, this is what our plan is. And so if X happens, our response is going to be, Y or Z or something like that. Okay? There is a risk in everything that we do. And we have plans for these things. It's no different now. So hopefully that kind of model is what you could use to go back to your communities and do that. You have to be a leader. You have to plan these things out. Go through what's called like a pre-mortem assessment, right? We do post-mortems, and I know it's kind of morbid to talk about this because it's a disease that kills people, but a post-morbid in pathology, obviously, you know what that is. A post-morbid in the business world, in any world, right? It's looking at what happens after, identifying what went wrong, what went right. You could do pre-mortems, right? What are the possibilities and what are the measures and behaviors that we're going to react, how we're going to react when something like this may happen, okay? If you do that now and spend, that's what you need to be spending time on now, okay? You do those things, you'll be ahead of the game here, all right? You want to have practice, start setting up, start getting everyone on board with what the expectations are. Okay. All right, let's see. Did you watch The Last Dance? I'll tell you what, I'm watching the last of The Last Dance tonight. So remarkable series, highly encourage everyone to watch it. Okay, this may be beyond your area of expertise, but what's the skinny on human to animal transmission of COVID? I think it's mixed. I wouldn't worry too much about it right now. I wouldn't worry too much about it. But I don't think, I don't pet anyone else's dogs right now. I probably don't do it even in a pre-COVID world. I just think keep your animals to yourselves right now. I think that's most important. I don't think your dog's going to get COVID if it's just outside, or your cat's going to get COVID if it's just outside. The risks of that are very low. I wouldn't worry too much about that. Okay, but I'm not the expert there, just so you know, obviously, and my experience and data is very limited there. Okay, in New Jersey, Celeste Ruggiero Gray, in New Jersey, we have been locked down very tightly since March 13th, and we are still up to 150,000 cases and growing by 1,500 per day. Why do you think this number is still climbing, and what hope is there for us as we begin to open up? You live in a concentrated, populated city that does not have the proper infrastructure in place I shouldn't say that yet. You live in a populated, concentrated city. You are not going to get cases to zero, all right? Remember this. Cases will keep happening. It's just the rate of the cases. There will be a baseline level of case. They're not going to zero. It's unlikely. They may go to zero. Let me just back up, right? New Zealand has no new cases right now. They will have cases. I promise you that. They will not be zero for long. They will have cases. Now, unless they've locked down the borders totally and there's been no new case in New Zealand for 2 weeks, then they may have no new cases. But in a place like New Jersey that has millions of people, the most densely populated, right? Growing up in New Jersey, right, we knew that New Jersey was the most densely populated state in the country. And so transmission, it's a respiratory virus. You're going to have transmission there. They're going to need to just find the level that is like that slow burn level in New Jersey. It's going to be inescapable. A place like New Jersey doesn't get cases down to zero. I doubt it. A place like New York doesn't get cases down to zero. You get them down, you could get them down low, but not all the way down. As you begin to open up in New Jersey, you will see a rise in cases, whether it's now or in a few months. How high that rise goes is going to be interesting, right? This is going to be an experiment. We're going to see what happens there. Marie Cuero. I'm pretty sure Maria is an incredible nurse at NYU ER. I believe so. I just can't see your picture. So I'm COVID positive 3 weeks ago. Wow. No symptoms now, but how long? I'll be contagious. So there's CDC guidelines for that. Well, first of all, I'm glad to hear you're doing better. That is number one. Dealing with COVID, just the emotional impact of that is really serious. We all have anxiety from the idea of thinking we may get it or when we're going to get it, and that could lead to PTSD type of symptoms. Someone who has it, who then doesn't know if they're going to get worse, will cause more anxiety and more PTSD like symptoms. So I'm glad to hear you're doing all right. That is wonderful news. CDC recently changed kind of the go back to work criteria. I don't have them in front of me. You could probably just go to CDC website and look them up. it was something that had to do with, no symptoms for 24 hours and 2 negative tests, right? There's a testing model and a non-testing model. So go ahead and you could look that up. And hopefully that's helpful to you. And I hope things go well, because what we also know is that COVID has complications, and potentially ones that we don't even know about now. Fibrosis of lungs was talked about earlier on, and we just hope that these things as minimal as possible in your case, Maria. So I hope you do all right. I just saw Beth Brown, Joniak, Gail Vogel joined. Any other questions? Feel free to post them. I think I answered most of these. Danielle McGuire, was Jordan a terrible teammate, or did his anger make the Bulls greatest ever? I'll take Jordan as a teammate any day. I don't care if he yelled at me. That wouldn't matter to me at all. Okay. Good. We got a bolus of questions here at the end that were excellent. And okay, here's a question from Zoom. As a layperson, how do we know if the COVID test or antibody test is reliable? Well, you could ask. You could ask, and unfortunately, most offices don't even know this, and that's just a reflection of kind of where we are right now. You can ask them, say, what test is being used, right? Most people are sending them out to the labs, but if they have it, what test is being used? What brand? What brand is being used? What's the sensitivity and specificity of the test that's being used? They should be able to know that, right? When you go to a hospital, that hospital could tell you, this lab test is, from XX company and comes with a sensitivity and specificity of XYZ. So you could ask, and they should be able to tell you. It's kind of like you buy a car and go to the dealer. Hey, what's the gas mileage? What kind of mileage does this car get? If they're like, I don't know, I mean, what does that say about them, right? Are you going to trust them with anything else that they're selling you? They should know that, and it should be accurate. So it's no different here. We should maintain a high standard for our healthcare professionals. When we go into an urgent care or a testing lab or doctors or whatever's office, right? They should know that, especially now. And so if you are a healthcare provider and you're listening to this, take 5 minutes. You could look up. You can find the data very easily of sensitivity and specificities of all the different tests that are out there. And even as a layperson, you could look it up yourself. Sensitivity says essentially, high sensitivities, it's a screening tool. Sensitivity is like more of the screening. Specificity is more of the confirmatory test. You could think of it that way. I'm just kind of being very, very general there. Kimberly Rott, welcome. Welcome to our gathering here. We have a lot of people joined at the end right now. More towards the end, there's a lot that we talked about. Feel free to leave a comment. I look forward to these Tuesdays every day. It makes my day. After this, I'm gonna go cook some shrimp scampi and have a glass of wine after this. So feel free to ask away. And I saw Damian Rocky and just has joined. I don't know if you're still on, but if you are, you should reach out to Damian if you're interested in any coding camps. He runs incredible, whoops. Sorry guys, 1 second. I just screwed this up. All right, let me get this back. Facebook Live. All right, I think I just disconnected Facebook. Okay, let me see here. We should still be live, right? Oh, I'm fine. Okay, good. I am fine, but I just lost my, all right, here we go. We're back. We're back.
Back, Facebook.
Let me just delete this. Okay, here, my comments are back. Okay, Grand Circus, sorry. I got caught up here. So, Grand Circus, if you guys want any coding camp, look them up. Okay, let's see what we got here. We got some great questions. Thank you, Harriet. I'm watching on Facebook. We see you. Yeah, you're here. Awesome. So, Danielle, are you done with your, are you done with your Zoom ride, your ride, your Peloton ride? What's the likelihood school in September and good idea or bad? Robin Schwartz, PR. You guys need any type of PR. Go to Rob. She'll do it. You don't have to be in Michigan. Robin Schwartz PR. Okay, make sure you look that up. It's a good idea for schools to open if they have the proper infrastructure in place. They have the proper leadership and guidance. Right. That's what we need. If they don't have the proper leadership and guidance, it's going to lead to increased risks. It's going to lead to unnecessary morbidity and mortality. But yes, we do need to get active. We need to get out and live with COVID. We have to do it in a deliberate, mindful, and safe way, though. Right? I mean, when it's kind of like, do you let your kids ride on a bike by themselves around your neighborhood in a way, right? Like what we say is, okay, like, are they prepared to do these things? What, do you teach them, you teach them these things. It's the same idea. These situations are similar, not the same. They're similar in that we have to just prepare everyone. We have to have a plan. We have to have contingencies. And then you could do it. Safe is a relative word now, all right? Safe is relative. There is no zero risk, no such thing as zero risk. Okay. Anyone, Dave Gorner, good to see you. I've been thinking a lot about you, trying to, I was going to get out to Jersey and then COVID happened. We'll have to find another time soon to get together. Got a lot of new people just joining up. You have any questions? Please leave the questions in the comment bar. We'll do this for just a little longer. If there's more questions, we'll keep going. But I know if there's any other. Scott Aronson just joined the recent. See here, Scott Aronson. You guys need any GI work in New Jersey? Reach out to Scott Aronson. He's an incredible GI doctor. Okay, and friend and person and human being. In fact, let me just say, Scott Aronson was my when I was going through medical school. Scott Aronson, he was my senior resident. I owe it all to you, Scott. Okay, Edith Mincer, my aunt. We are thinking of the students. What is the risk for the adult staff? No, I'm thinking of the adults as well. In fact, that has always been my issue, right? I always ask, what 70-year-old teacher is going to go into a classroom full of, 35-year-olds running around who are slobbering, all each other, who are going to get runny noses, who are going to be sneezing and coughing. That is a real risk. And it's a great question to have, and that's why you need to get the teachers who, you need to bring them in, you need to have them help make these decisions, right? And to say, okay, this is what we have the plan for you. You're going to wear a mask. You're going to stay, you're 6 feet apart from the students. If you can't do that, then we will contact this person to help you. Right? These are the things that we need to be talking about and discussing now so that we can have an environment that is as safe as possible. Okay? That's how you do it. I mean, that is how you do it. And risks will not be zero. So we need to think about those things. Okay. Yes, so, Danielle McGuire just commented, like, what any teacher? Well, I think if you're wearing a mask and you're distancing yourselves and, schools potentially, schools could potentially be outfitted. I doubt they would do this, but they could be outfitted with negative pressure rooms. Maybe classrooms could have negative pressure in there, like hospital rooms do. Granted, most schools don't even have air conditioning. I doubt they're going to be able to do negative pressure, but these are the risks, and the schools need to make these decisions together. I think if you're in a low prevalence area, then it's a little different decision than if you're in a high prevalence or high incidence area as well. There's no response that I could give or anyone that could give that would say, okay, do it this way or do it that way. Okay? There is best practices, there's morals, ethics, ways to approach these things from, the leadership standpoint, the managerial standpoint, to be able to implement systems in the best possible way. We want to do this with decision making from everyone here, right? I mean, everyone should be helping to make decisions. We should get input from everyone as well. The diversity of thought is going to be really important as well here. Okay, all of these things are really, really important. Mike and Yana, good to see you again. Emery Yarnoff, good to see you. All right. Any other questions? We had a nice push, nice group of people join here at the end. I don't know if this is just some Facebook glitch or what, but definitely had a handful of people join here at the end. Some really great comments, and feel free, you guys, if there's any other comments, leave them. Happy to answer them. I appreciate the time that you've given, and just know, for all the new people, we talked a lot in the beginning, kind of about the current state, vaccine, what to expect moving forward. Here's one more question. Can young children play one-on-one with each other outside with distancing, with parents monitoring, tossing the ball around, riding bikes? Yeah, I think you get to decide. Am I going to take these risks, by implementing physical distancing, mask wearing? And if I do those things, then sure, we can have kids kick the ball. This weekend, or recently, I played soccer with a group of people. We had some dads, we had some sons, and the dads guarded the sons. It was a great idea. And, we played soccer, and it was kind of right. We stayed with 6 feet, and we were outside. And so I felt pretty comfortable doing that. And that's the type of thing that we need to be adapting to right now, right? It's not that we can't do these things. We just have to change our mindset and how we do them and implement things in a little different way. And I think that should be pretty reasonable to do. We cannot stay inside. We cannot hide. We need to engage, but we need to do it in a smart, intelligent, mindful way. We've been saying this for months. Just remember, flattening the curve does not change the area under the curve, okay? And what that means is we're not decreasing the number of infections here. I spend almost every one of these sessions talking about what the end looks like here, and I did it on this session. One way or the other, 70% or so, give or take, people will have antibodies to COVID. It will be through natural infection or through immunization, one way or the other, okay? So one of the other things you could do is do your best to be mentally strong, physically strong right now as well. This is a slog. This is going This is a year to 2 years of the future ahead of us, maybe even more. It's possible, guys. And this is stressful on everyone. And so, like I started back in March telling everyone, you got to rely on each other and on community here. You have to. You can't let your guard down, your physical guard and your emotional and psychological guard, because you're going to be tested like never. I shouldn't say never before in your life. People here have been tested, I'm sure, with quite extreme circumstances. But this is going to be a major test for most people. All right. All right. Well, thank you all for joining. It's really wonderful to see everyone. Like I said, I look forward to seeing everyone. And, bring more people next week. Bring more people. Bring more questions. And I'll be happy to answer them. And if you want me to do a little research before Tuesday, feel free to shoot me. Feel free to shoot me a DM, private message, whatever it may be, and I could do a little research, and do this stuff. So thank you all. This use this time for self-reflection, growth. I shouldn't say this is a good time for self-reflection and growth, and it's an opportunity as well in many ways. So let's take advantage of it while we can. Not while we can, but let's take advantage. Let's make the most of it. Let me leave it at that. Ms. Burkhart, I'll see you next week. I miss you. I miss Anthony. I think of Anthony all the time. One of the funniest guys I know. I really do. I think about him so often. And looking forward to the day that we could all get together again. Thank you, everyone. Have a really wonderful day. And I'll see you after Memorial Day. Hey, physically distance, mask wearing, Memorial Day. Okay? Don't let your guard down. Don't let your guard down. Be tough. Okay. Talk to you guys later.